Here comes the most important part, my friends, in asthma, which is called as management. So please pay attention. Management of the asthmatic patients is divided into three main steps. First comes the patient education. The second step includes avoidance of the extrinsic factors. And the third step include use of the medications and the drugs. So let's crack these steps in a more detailed manner. So, in patient education, the aims of treatment are to abolish the symptoms, restore the normal possible lung function, and reduces the risk of severe attacks. Okay, so this involves patient and family education about asthma, very important. Second, patient and family participation in treatment. Third, avoidance of identified causes. And fourth is the use of the lowest effective doses of the medications to minimize the short term and the long term side effects of drugs. The second step include controlling the extrinsic factors. According to the British Thoracic Association, 35% cases of asthma can be managed by the avoidance of the extrinsic factors. And these extrinsic factors include occupational agents, which include low molecular weight compounds such as reactive chemicals, isocyanates, acid anhydrase, by the avoidance with the pets. And the most important factor is smoking. What about NSAIDs? They are avoided in asthma. Why? Because NSAIDs inhibit arachidonic acid metabolism via cyclooxygenase pathway, which prevents the synthesis of prostaglandin E1 and E2. And prostaglandin E1 and E2 plays a major important role in bronchodilation in asthma. The third step in the management of asthma include using of drugs. And these drugs are divided into four major types. So the four major types include short-acting relievers, which include inhaled beta-2 agonist, example salbutamol. Long-acting relievers, which include inhaled long-acting beta-2 agonist, example salmeterol, and inhaled corticosteroids, example beclomethasone. Third class include bronchodilators, which include inhaled antimuscarinic agent, example ipratropium. And the fourth class include oral prednisone. I know it's confusing. Let's have a quick mnemonic to memorize it. Here comes the mnemonic. Sam C bring ink from packet, where Sam stands for salbutamol, C stands for salmeterol, bring stands for beclomethasone, ink stands for ipratropium, and packet stands for prednisone. Easy and fun. Let's discuss short-acting beta-2 agonist salbutamol. Salbutamol is a beta-2 adrenergic receptor that is used to treat asthma, bronchitis, COPD. But why it is used? Because it relaxes the smooth muscles of all airways starting from the trachea to the terminal bronchioles, thus protecting the lungs from bronchoconstriction. It is given in inhaled form like 2 puffs daily. What are the side effects of salbutamol? Well, remember this mnemonic. Take hamburger to school, where take stands for tremors, hamburger stands for headache, and school stands for sore throat. Easy. Second subdivision include long-acting salmeterol. Well, long-acting salmeterol is used in poorly controlled asthmatic patients and it is used for a long-term maintenance therapy or treatment. Inhaled salmeterol belongs to a group of drugs called beta-2 agonist and these are long-acting. These drugs stimulate beta-2 receptors that are present in the bronchial musculature and this causes them to relax and prevents bronchoconstriction. It also prevents the severe asthmatic symptoms like wheeze, cough, breathlessness, and helps to control them. Here comes the fun part. The side effects of salmeterol, which can be remembered by using a mnemonic, which is Daniel helps boss. Daniel stands for difficulty in breathing, helps stand for hives, and boss stands for blurred vision. Beclomethasone. Inhaled beclomethasone is given in the patients who have severe symptoms of asthma And it's also given in the combination therapy with long-acting beta-2 agonist. Beclomethasone is a synthetic glucocorticoid that act by binding to the cytoplasmic glucocorticoid receptors, which are present on the nucleus of steroid elements of DNA molecules. This inhibits the messenger RNA, which in turn inhibits transcription factors, nuclear factor kappa B. And this overall mechanism results in the suppression of inflammation and the immune response. By the way, friends, you can also watch our video of immunosuppressants on sqadia.com, which has detailed knowledge about the corticosteroids. Let's talk about the side effects of this drug. Well, I have a mnemonic for it, which says RON presents hamper, where RON stands for rounded plethoric face, or you can also say moon face. Presence stands for purple stria, and hamper stands for hyperglycemia, which is seen in diabetes. What if the symptoms they are uncontrolled with the high dose inhaled corticosteroids? In that condition, you have to consider bronchodilators, which include anti-muscarinic agent ipratropium. Ipratropium bromide is the anticholinergic. It's a medication that open up the medium and the large airways in the lungs and prevent the bronchoconstrictions of the bronchioles. Ipratropium is given in combination with the beta-2 receptor agonist. And what are the side effects of ipratropium? Well, ipratropium causes 3 Ds: dizziness, dry mouth, and difficulty in swallowing. Dear friends, here comes the last division of the drug which is used in asthma, known as oral prednisone. Oral prednisone is considered in patients who cannot tolerate inhaled corticosteroids. And what is prednisone? Prednisone is a synthetic anti-inflammatory glucocorticoid. It is derived from cortisone and it is biologically converted into prednisolone in the liver. It reduces inflammation by inhibiting synthesis of messenger RNA that will inhibit transcription factor nuclear factor kappa B. What are the side effects of prednisone? Well, prednisone can cause 3 N's, and those 3 N's stand for N for nausea, N for nystagmus, and N for nose bleeding. Easy! Dear friends, now let us draw our attention towards the complications that can be caused by asthma. According to the National Institute of America, it can produce narrowed bronchial tubes in about 10 to 30% of patients, sleep disturbances in about 20 to 50% of patients, respiratory failure in about 5 to 10% of patients, and also disrupts the daily life activities like bicycling, going to school, about 15 to 20% of patients. What is the prognosis of asthma? Well, asthma is a chronic disease that requires the regular maintenance, therapy, and treatment. And with appropriate treatment, many individuals are symptom free. Thank God. But if asthma is not adequately treated with inhaled corticosteroids, then there is a problem. The lung functions they deteriorate over time, and this allows the airflow obstruction, which becomes irreversible. So, risk factors for the death from asthma include poor treatment compliance, intensive therapy unit admission, and hospital admission despite the steroid treatment. That's all for today. For my next videos, please stay tuned to sqadia.com.